Okay, guys, I have tonight's discussion B for you. We're going to be discussing classifying older adults requiring long-term care into 5 groups and clarifying their prognosis, expanding on its significance and methodology. Purpose and scope of study. This research tackles a pressing issue in aging societies: how to effectively categorize and care for older adults who require long-term care support, recognizing that aging-related disabilities are often multifaceted, spanning physical and cognitive and emotional domains. The study sought to move beyond traditional one-size-fits-all approaches by applying unsupervised machine learning. The researchers aimed to uncover hidden patterns and functional decline and create a more notions classification system. The study focused on individuals age 65 and older in 2 Japanese cities. Tsukuba and Kashiba, which provided a diverse and representative sample of older adults receiving care under Japan's long-term care insurance system. Data collection and classification process. Researchers utilize data from Japan's Care Needs Classification Survey, a comprehensive tool that assesses older adults across 74 functional items, including mobility and physical strength, cognitive function, and memory. Communication ability, daily living activities, bathing, dressing, behavioral and psychological systems. Using data, they applied machine learning algorithms to identify 5 distinct subtypes of care needs in Tsukuba. Subtype characteristics: mild physical, slight mobility issue, generally independent, mild cognitive, early stage cognitive decline, minimal physical impairment, moderate physical, noticeable physical limitations from some assistance needed. Okay, moderate multi-component combined moderate physical and cognitive challenges. Severe multi-components, significant impairment across multiple domains. These stereotypes were then validated using similar data from Kashiwa, confirming the robustness and generalizability of the classification. Prognostic outcomes. The study did not stop at classification. It also explored how each subtype correlated with key health outcomes over time. Mortality rates higher in served multi-component group. Hospitalization frequency increased with complexity of impairments. Institutionalization more likely among these with combined physical and cognitive decline. Absolutely. Let's dig deeper into the implications this study has for elder care. Especially in the context of aging populations and resource constrained systems. Strategic implications for elder care. Precision in care planning. By classifying older adults into 5 distinct subtypes, care providers can tailor interventions to match specific needs rather than relying on a broad categories. For example, someone in the mild cognitive group might benefit more from memory support and social engagement than physical therapy. Proactive resource allocation. Governments and healthcare systems can forecast demand more accurately knowing which subtypes are more likely to deteriorate or require hospitalization helps in budgeting and staffing. This could reduce unnecessary institutionalization and promote aging in place strategies. Early intervention and prevention. Identifying individuals in moderate, multi-component, or severe multi-component groups allows for early targeted interventions such as fall prevention programs, cognitive training or caregiver support. This may slow progression and improve quality of life while also reducing long-term costs. Enhanced training for caregivers. Caregivers can be trained to recognize and respond to specific challenges associated with each type, whether it's managing behavioral symptoms, supporting mobility, or facilitating communication. This leads to more empathetic and effective care. Policy and insurance reform. Long-term care insurance systems could evolve to reflect these subtypes, offering tail, tailored coverage or benefits based on prognosis and complexity. Policymakers can use this data to design equitable systems that prioritize those at highest risk. Technology integration. Digital health platforms and AI tools could incorporate these classifications to automate assessments, monitor changes, and alert providers to shifts in condition. This opens the door to remote care models and smarter home-based support. In short, this classification systems transforms elder care from a reactive, generalized model to a personalized, predictive, and preventative framework. It's a shift toward treating older adults not just as patients, but as individuals with unique trajectories and needs. Okay, folks, so that is it for tonight. I will see you guys tomorrow for shows in the afternoon, about 2 o'clock. So I'll be on at 2 tomorrow for shows. So see everybody tomorrow for shows. Until then, Gator Wellness. Take care, folks.